Hello, my name is Rosie Gardner, and I am a qualified auditory-verbal therapist. I have been a deaf educator for many, many years, over 45. In 2015, I began my training in auditory-verbal therapist, and I am passionate about sharing my knowledge and expertise. I was also born and brought up in Kenya, so I have a great love for East Africa. I'm guessing if you're watching this, that maybe your wish for your deaf child is that they will develop spoken language. For over 90% of deaf children, they are born to hearing parents. And so most parents do want their deaf child to learn to talk in the language of their home, whatever that language is. And the research shows now that with all the evidence we have, this can happen, but it doesn't happen like this. So, if that is your wish that your child develops spoken language, I want to let you in to a secret. There is hard work ahead for you as parents. We cannot leave it to others. Some people think they will go off and earn a lot of money so that they can pay for their child to attend speech therapy every day. But sadly, that is not going to be the way we get success. So how do we reach our successful outcomes? There are 4 real sides to this. The first one is early diagnosis. We must have a child diagnosed early if we want their auditory or their listening brain to develop. Of course, the ears are only the way to get to the brain, and the brain is where we want the information to get to. The auditory, the listening brain needs to start to be programmed and listen in order for speech to develop. I ask many parents, what is your desired outcome? What do you want for your child in 5 years' time, 10 years' time? What do you want? Do you want your child to develop spoken language? If that is what your choice is, we need you to be highly involved in what is happening for your child. Don't leave it to others. It is parents who are key. So the first thing is early diagnosis. And if you think your child is deaf and you go to the doctor and the doctor says, leave it for a while, they may be just late, make sure you push and get your child checked properly to go through tests, because we do not want a child to be delayed in being diagnosed. I find mums especially and dads can start to think my child is deaf, but nothing is done because the doctor says leave it for a while. Don't accept that. Go for expertise. Now go to people who know, audiologists who can diagnose properly. So that's the first thing, early diagnosis. If possible, before a year old, that's ideal. If you are expecting a baby, ask for a screening on your baby when they're born. You need to be able to know early, but certainly before they're 4 years old, we need early diagnosis. Secondly, you need programmed state-of-the-art listening technology, hearing aids or cochlear implants that are well programmed by qualified audiologists. Make sure they are programmed by a really well qualified audiologist. Early diagnosis, state-of-the-art hearing aids or cochlear implants that are very well programmed. Thirdly, attending the right kind of therapy. Now, traditional speech therapists are not qualified on the whole for working with deaf children. You need to find someone who is being qualified, being trained, or knows more about how to develop spoken language. I am training a speech therapist in Kenya and a speech therapist in Uganda. And there are some who have had a little training, but make sure you ask the questions. Parents, don't be satisfied with people who say they know a little bit, and you're not sure they do. The difference between a speech therapist who's traditional and a speech therapist who has some training is parents are in the session, involved, collaborating together with the speech therapist. That is something I hope to do more of, to explain how a parent can collaborate with a speech therapist who is training in auditory-verbal therapist. Now, that's the third thing, attending a qualified speech therapist who is training in auditory-verbal therapy. The fourth thing, and this is crucial, parents involved. Parents are the ones who will see their child much, much more than anybody else. Parents are the true therapist. So an auditory-verbal therapist is working with the parent in guiding them, helping them to do it every other moment of the day. The cochlear implants and the hearing aids need to be on that child all waking hours. They need to be working really well. And that is the responsibility of the parent. So that is absolutely crucial. And if that doesn't happen, the brain cannot start being programmed. So that is what's happening, is the brain is now being reprogrammed. And it's absolutely crucial that parents know what they're doing. So that's what I'm involved with. I'm involved with training speech therapists, 2 speech therapists, one in Kenya, one in Uganda. And I'm involved with training parents so that they can be able to carry on the work. And together, we will build the brain to be able to develop spoken language. Thank you.